Hello students, welcome to VHS e-classes. So today we are going to discuss about another important chapter in nursing research, that is quasi and pre-experimental designs. So in a previous lecture we have discussed about experimental designs in detail, and today let's talk about some of the designs which comes under the category of experimental only, but with the two basic principles. If you remember, in a previous lecture we have discussed about there are the three basic principles of experimental design, that is randomization, control and manipulation, okay, or what we say intervention. Okay, if these three principles are applied, then we call it a experimental design. But if any research design is lacking the first one, that is randomization, then the design is known as a quasi-experimental design. So what I'm trying to tell you is quasi-experimental design are the non-randomized control trials. These two principles are always there, control and intervention. Similarly, when we talk about the pre-experimental design, usually the pre-experimental design are lacking these two basic principles. They do not apply randomization. At the same time, they also do not focus more on putting control over the extraneous or confounding variables. So let's discuss the concept of these designs in detail. First, we'll talk about the criteria for true, quasi and pre-experimental design. Even though the same criteria already I have explained you, but if you remember these questions like is there is an intervention, there could be two answer, no or yes. If answer is no, then it is called as a non-experimental, which we are going to discuss in the subsequent classes. If there is an intervention, then the design is a experimental. Now the point is, if there is an intervention, next question is there is a random assignment to the treatment and control group? So if there is a random assignment to the treatment and control group, if answer is yes, then we call it a true experimental design, which already we have studied. But if there is a no randomization, if there is a no random assignment of subjects in the different treatment conditions, आपको याद होगा, you would remember that whenever you do experimental researches, we usually have experimental and control group. The concept of experimental group means a group that receive the intervention, whereas the concept of control group is a group who is being used as a comparison group. Okay, they receive either no treatment or some other treatment, or the treatment other than the intervention. So how do you assign subject in these two groups? So if they were assigned in a random manner, okay, by adapting a probability technique, then we call it a experimental or true experimental design. But if there is a no random assignment, you have taken two groups. For example, let's say you have taken BSc first year as an experimental group and BSc second year as a control group. In that case, then the design is known as a quasi-experimental one. As you can see, the question here is, are there effort to compensate for the lack of randomization? So you have not done randomization, you made it two groups. Suppose there is 100 people and you want to divide these 100 people into two groups, like as 50 and 50. So how you have assigned or allocate these 100 people into two groups? If it is a random, then we call it experimental. If not, then question is there is any compensation for that? Yes, there is a compensation. What is that compensation? We do not have randomization, okay, accepted, but still we have a control group. Still we have a group of subjects against which the performance of the subject in experimental group would be compared. So for that reason we say yes, there is a compensation, so we call it a quasi-experimental. But there are certain designs where We even do not have any compensation for the lack of randomization. You have not done randomization, but here you had a control group, or what we call a comparison group. But suppose sometime you have, let's say, 100 people, and these 100 people were given some kind of treatment, and you just assess their test. Okay, you assess their post, you conducted a post test. So such designs where only one principle, that is intervention, is being applied, and we missed the two important principle, that is randomization and control group, then the design is known as a pre-experimental design. So let's discuss one by one in detail. Now, concept of quasi is already done. Why we conduct quasi-experimental designs? Because sometime if randomization is not possible, and there are many situations where randomization is not possible. Let's say you wanted to see the effect of a specific motivational counseling among nurses working in a hospital. So it would be difficult to keep half of the nurses in intervention group and half of the nurses in control group. In such situation, what you can do is you can take the nurses of one hospital as a experimental subjects, or nurses from another similar hospital as a control nurses. Okay, so in such situations you can apply the quasi-experimental. So basically there are two basic types of designs you can see here. One is a non-equivalent control group design, and second is a time series design. So when you talk about non-equivalent control group designs, so these designs include comparing a treatment group with a non-equivalent control group. Now, please understand this. What is non-equivalent? Non-equivalent means a group which is not equal. Usually, if you look at the layout in any experimental design, the layout would be randomization, then there is experimental group, randomization and control group. Okay, and then there will be a treatment, no treatment, and there is a comparison, or what we say test. Okay, this is what a general, and we compare. Now the main purpose of this R, that is randomization, is to equalize the group. As in this particular design, this R is missing. Okay, this R is missing, and that is why we call it a non-equivalent control group design. Okay, the name itself, because we assume that if randomization was not done, the group is not equal. That's why the name is non-equivalent control group design. Okay, second is, that is time series design. In this design involve tracking the data over a period of time. Researcher analyze the trends and pattern with this particular type of research. So time series, what they're doing, they are making the observation of the same subject with the same outcome variable at multiple point of time. Like for example, if I make an observation on day 1, then again on 7th day, or on 15th day, or on 30th day. So if I conduct the multiple observations of the same subject, then we call it a time series design. And with that we can overcome with the fluctuation with the time, and some trends or changes with time can be identified with this kind of design. Both of these designs are quasi. Why? Because even though they do not have randomization, but they are making a compensation due to the lack of randomization. In non-equivalent group, we have a comparison group. And in the second time series, again we have a multiple observations. Okay, so let's discuss that in detail one by one. Now, if you talk about the non-equivalent control group design, as you can see, it is same like pre-test, post-test control group design as we have seen in experimental research. Only the difference is it is something where we are lacking the randomization. So here we have experimental group, we have a pre-test, we have a treatment, and we have post-test. So this kind of design we call a non-equivalent pre-test, post-test design. What we say? Non-equivalent pre-test, post-test design. Okay. So what we are doing here is we are making two groups, experimental control, then there will be pre-test, what we call that observation 1, and then there will be a treatment, and no treatment, and observation 2. So that kind of design is called as a non-equivalent control group design. Now, when you talk about the non-equivalent control group design, these designs are more practically feasible as compared to the experimental designs. Only the problem or demerit with the non-equivalent design is that as we are lacking randomization in this, so they are non-equivalent. So people can say that the group was not equal before doing their intervention. This is quite possible because lack of randomization is always will be considered as a flaw for this design. But there is a pretest. So even randomization was not done, but pretest will give you an idea about the equivalency of the group. Let's say in the experimental group they had the mean value of 20. Same way we can check the mean value of control group even though randomization is not done. Let's say they are on 19. So we can say they seems to be comparable. So that's why this design is good design, I can say, as compared to the other pre-experimental designs. Then next is a time series design. So when you talk about a time series design, what time series design says, first understand the concept of time series. There are phenomena, there are things that we need to study over a period of time. Let's say I just want to conduct a research where I want to see the effect of a assertive training program among nursing students. Now, you know that assertive training is it's a personality trait which do not change over a period of time. So if I do this kind of research, like let's say observation, where I assess the observation, I assess the someone's assertiveness by making an initial observation. Then there is a treatment. I have given some training program on assertiveness, and then I observe them after 15 days by making a O2. Now the question is it how far it is possible that with one observation someone's behavior will change? Someone is very passive or aggressive will turn to be assertive. So answer is it is not possible, or I will not be able to see the effect with a short period of time. So what I can do is, instead of making second observation, I do third observation, observation 3, maybe after 15 days, and maybe observation 4 after a month. So with that I can see the changes. So that is a one logic of applying this kind of design. Apart from that, there is another thing where I find these designs are more useful. Let's say you are going to study a phenomena which fluctuate with time. Like we know that if you are studying impact of any health education program in terms of the prevalence of malaria, after giving this health education program, how far the prevalence of malaria has come down. Now suppose you have started giving an intervention program in the, let's say in the month of you started giving program in the month of March. Okay, and in the month of March you made a first observation. Okay, and let's say the prevalence was, I say like 10%. Okay, and then you given them a health education, and health education was given in the month of April and May. Okay, and June you made observation. So in June there was a prevalence of 15%. Okay, so maybe it was rain has started. Okay, in June, July, that we know is a rainy time. So because of that, the chances of the prevalence of malaria automatically will raise. Okay, so now we cannot say that the intervention program is not effective. What we can do is we can make a multiple observation. Instead of that, what I can do is let me make observation 1 in the month of March, observation 2 in the month of, let's say, April, observation 3 in the month of May, and then intervention, and then I'll observe again observation 5, observe 4, observation 5 or observation 6 I can make in the month of June, July and August. So when I do that, with that I can compensate my things. Okay, so if there is a fluctuation in the prevalence of malaria because of the change in the climate or because of change in the weather and other environmental condition, that can be neutralized with the time series design. So these are the two important advantages where we can use this particular design. Now let's talk about what are the different types of time series design. So as you can see, there are different types of design. The first one is a interrupted time series design. What it is, there is the fundamental things will remain same for all the designs. There will be a multiple observations of the outcome variable from the same subject, okay, but there could be some variation in that. So first is a interrupted time series design. What is that? You made observation 1, observation 2, observation 3, then there was an intervention, then observation 4, 5 and 6. In that you have introduced your intervention at once and you made a long observation. The example which I have given, let's say you have given a motivation counseling on maybe January, February or March. April you have given them some kind of a motivation counseling and you observe them in the month of April, May or June, in that way. Then time series non-equivalent control group design, same like as you can see, but there would be a control group. So you have two groups and you made a multiple observations, okay, with that. So like let's say the nurses of one hospital were observed for first 4 months in terms of their burnout. After that they have given one counseling to overcome with the burnout, and again they have observed for next 4 months to see their burnout level, okay. And we always made a comparison with the comparison group here. There is a second group, the another hospital is taken, similar hospital is taken, where they have observed with the same outcome variable, that is burnout, and then we have compared this. So you can always make comparison like 1 versus 1, 1-to-1 comparison is possible with this, okay. So this is what we call a time series non-equivalent group design. Now time series with multiple institution of the treatment, like in this particular example, if you see, there is only one time intervention was given. But suppose in the same example, nurses were observed with their burnout for 4 months, then they have given one burnout management training, and then again observation for next 2 months, again the same treatment was provided, counseling, and they were observed. So that kind of things where we introduce the treatment multiple times, okay, 2 or more times, then we call it a multiple institution of the treatment. Next is time series with the intensified treatment, okay. So name itself says intensified treatment means where you increase the dosage of the treatment. As you can see, initially you made observation 4 times, same subject. Then let's say you introduce one particular intervention. Let's say you have given motivational counseling to overcome the burnout. Then again you made observation. In a second time you have given a motivational counseling to manage burnout, okay, along with some other things, okay. Maybe it was for 30 minutes, now you have given is for 1 hour. Again you observe them, and so you keep on changing in the intensity of your treatment, okay. So that's kind of thing is called as an intensified treatment one. Then we have time series with the withdrawn and reinstitution of the treatment. So as you can see here, same observations, but what we do, we introduce treatment once and we withdraw it from there, okay. Like as you can see, initially we made observation, okay, then treatment was planned, but we have withdrawn that treatment to see the effect. If the treatment is not given, what happened, like for example, the nurses were observed, okay, and the intervention was what will happen to the nurses if the timely increment is not given. So initially 4 months we observed their attrition rate, that how many nurses are dropping from the hospital, and their appraisal was scheduled in the month of January, which was not given to them, and then again we have checked what was the rate of attrition, and then after institution of the appraisal, okay, then we introduce the appraisal system, and then we see the impact on that. So when you have your intervention which you withdraw from the scheduled time and reinstitute there, okay, so that kind of design is called as a time series withdrawn and reinstitution of the treatment. So these are some of the important time series design what we can see here. Now in the last, what we can discuss here is what are the merits and demerits of quasi-experimental designs. So of course the merit is very important, they are more practical because randomization is not required, so you can is more feasible. Then difficult to conduct the true experiment in the nursing research in real life setting, it is I told you that it is really very difficult, because whenever you do randomization, you need to have the provision that how you are going to separate the participants to mingle up with each other, those who are in experimental and control group. Okay, so therefore this kind of design where you utilize one college or one group, or one sets of people in the experimental group, and the people from some other institution as a control group. So introduce some research control when full experimental rigor is not possible. That already I told you that if you talk about the superiority of research design, we always say it is the experimental design. But if experiment is not possible, then what next possibility? What next possible design we have? That is a quasi-experimental. Then several rival hypotheses competing with the intervention as explanation for the results. So this is a demerit basically, but still we consider as a merit. Why? Because at least we acknowledge or limitations in this particular design. Like if we are lacking the randomization, but there is a compensation for that, we also can make out how far this lack of randomization has created a flaw or error in the problem or in the research or inquiry. So that we always can take under consideration. So this is a good part, that it always takes its weakness into account and while interpreting the results. If you talk about the demerits, so one is that it is not like a true experimental, there are several rival hypotheses are there. Like for example, people can say as group were not equal, you have not done randomization, so group are not equal and we don't believe in these treatments or these results. Okay, take the weakness into account interpreting the results. So that is the one advantage you can say, but of course we are acknowledging our weakness there, our limitation. So the first question that everyone will ask from you if you do quasi, why you are not preferred for the true experimental design. Okay, then conclusion depend on the human judgment rather than more objective criteria. So even though these are the designs which is good to determine the causal relation, cause and effect relationship, but as they are lacking the randomization, and for that reason there is always a question about the objectivity of the research findings. Okay, there are more subjectivity. People can say that a specific group is given a advantages, okay, and as they were not given a chances of being selected equally in the experimental and the control group. So these are some of the merits and demerits. So overall I can say the quasi-experimental researches are next to the experimental researches which are lacking the randomization. They are the good design to be adapted when experiment is not possible, where true experimental designs are not possible, and they are going with the two basic principles, that is a control. They try to maximize the control over the extraneous variable, and second is they are always having an intervention. Next we'll talk about the pre-experimental design. So it's a very brief topic, so we'll just talk about this. I read it about pre-experimental. These are the methods that we should never adopt while conducting the researches, but it is very unfortunate that whenever we see most of the thesis, we find pre-experimental as a selected design. So it's a design where people select because of their convenience. Okay, otherwise I personally did not find any reason of taking the pre-experimental designs. Okay, so what are these designs? Pre-experimental designs is a name applied to the experimental designs only, which are considered very weak and in which researcher has little control over the research variables. Now what variables? They have a little control over the confounding variables or extraneous variables. Okay, so please understand. So again I'll write three principles here. One is randomization, second is intervention, and third one is a control. If you apply all these three principles, we call it experimental. If you apply these two principles, we call it a quasi. And if you apply only one principle, that is intervention, then we call it pre-experimental. So pre-experimental designs are the design which apply only one principle, that is intervention. Okay, so in that we'll talk about the two basic designs here. One short case study design. So if you look at this layout in the last, what we do, we select a group and we provide the intervention. Let's understand with one example. Suppose you've taken a group of 50 students, okay, and you have given them, let's say, an health education on a particular topic, let's say on PPE, okay, and after that you assess their knowledge, okay, and you see the knowledge and just see how the knowledge is increased. So in this design we do not have pretest, इसमें pretest भी नहीं है, इसमें there is no comparison group, okay. So how we will know that before the intervention what was the knowledge level of these students? Okay, accepted. If someone is saying after giving the intervention on knowledge regarding PPE, everybody had a 90% knowledge. Out of 10, 9 questions they answered correctly. Now, can we say that their knowledge is very good? Okay, but is it because of the intervention which you have done? Why can't we say that before the intervention they had a very good knowledge and your intervention has caused nothing in that? So that explanation cannot be done with this, because we do not have pretest, we do not have a control group for that, okay. And there are so many other threats. Already I have discussed about, while discussing about the internal validity, there could be some other factor. Maybe other than your intervention, they had a recent class on PPE. Maybe they have been, recently might have participated in some intervention on the same topic. So these kind of things cannot be ruled out when you have this kind of design. So there is no comparison, there is only single measurement and there is an intervention. Now what is second design? One group pretest post-test design. It is slightly better than what we have discussed from the one shot. What we do here is we have observation, pretest, treatment and observation too. This is what the design, and many of nursing students I have seen are using this particular design, okay. So now you may think that there is no problem in this design because there is a pretest. If the same student is 50 student is given a knowledge, intervention on a PPE, and you see their knowledge, and before that they had a 70% knowledge, after this intervention the knowledge increased to 90%. So now that problem what we had with the one shot is being solved here. We know that before the intervention they had a 70% knowledge and now their knowledge is increased to 90%. So 20% increment is there. So can we say the intervention is effective? Yes, we can say that intervention is effective, but still there are many threats that may affect. Again I say, maybe pretest has caused sensitization. When you ask them question regarding the PPE, okay, and before giving an intervention, maybe after giving an intervention, you have given some time for the post-test, and during that period they studied about PPE in the class, they have watched a documentary on that, or something similar happened, okay, in that college or in a hospital. So all these external events or sensitization of the subject due to pretest, okay, might have caused this increment from 70 to 90, okay. So if you put a control group in this, then we can even rule out the effect of these threats. But as we do not have any control group here, that is why this design will have that flow, that problem would be there. So these are the two important pre-experimental designs. So in last I can say about these designs, pre-experimental designs should not be considered as a first priority of doing any experiment. So you should always ask the question, if you are selecting a pre-experimental, ask this question, why not quasi? If you are taking quasi, then ask the question, why not the true experimental? Okay, so in that way you can decide. So you should have a proper justification of your selection of the design. Overall, all three designs, true, quasi and pre, having a one common principle, that is the intervention, okay. But randomization is a very strong principle which equalize the group, or not only equalize the group but also put control over the extraneous variables or factors. Because most of the nursing studies where we involve with the patients, okay, or nursing students, or we talk about the human beings that mostly get involved into that. So randomization may not be possible, so you go for quasi. But whenever you go for quasi, always try to control or maximize the control over the extraneous variable. Already I have told you what is extraneous variable, the variables that may affect the outcomes of your research, and deliberately researcher want to control that. Okay, so the research design that put a maximum control over these variables are considered as a very superior design, and for that reason we always say that RCTs, randomized control trials, are more superior than the others. So this is all about this lecture of pre-experimental, quasi-experimental and experimental designs. I hope you might have understood this topic. If you have any queries related to that, please put me in a comment box. Thank you so much.